Insulin therapy often is an important part of diabetes treatment. In this video, we will talk about a Toujeo, a medicine-contained insulin. First of all, it contains the active substance insulin glargine. Toujeo is available as pre-filled pens containing a solution for injection of 300 units ml. Toujeo is a medicine used to control blood glucose, sugar, levels in adults and children from 6 years of age who have diabetes and need insulin. It is injected once a day under the skin in the abdominal wall, tummy, the thigh, or the deltoid region, shoulder. The site of injection should be changed with each injection to avoid changes to the skin, such as thickening, that would change the way the insulin is absorbed. The patient's blood glucose should be regularly tested to find the lowest effective dose. Toujeo 300 units ml must not be used interchangeably with the lower strength insulin glargine 100 units ml. Diabetes is a disease in which the body does not produce enough insulin to control the level of blood glucose. Toujeo is a replacement insulin that is very similar to the insulin made by the body. The active substance in Toujeo, insulin glargine, is slightly different from human insulin. The difference means that it is absorbed more slowly and regularly by the body after an injection, and that it has a long duration of action. The replacement insulin acts in the same way as naturally produced insulin and helps glucose enter cells from the blood. By controlling the level of blood glucose, the symptoms and complications of diabetes are reduced. The most common side effect with Toujeo, seen in more than one patient in 10, is hyperglycemia, low blood glucose levels. Reactions at the site of the injection, redness, pain, itching and swelling, and skin reactions, rash, have been seen more often in children than in adults. That's some information we collected. Thank you all for being here today. I appreciate your time and attention during the video. If you have any questions or feedback, feel free to share.